Welcome back. We at HCN are talking today to an eminent preventive cardiologist and geriatric physician, Dr. Lenny DeCosta, and his special treatment. So, doctor, to continue, what are the results that the patients see in this unique treatment of yours?
See, most patients come to us with trouble in their routine activities. They come to us probably very late when they have already gone through either had a heart attack or they've gone through an angiogram, or some cardiologist has told them that their heart is not doing well. Either they're scared of doing a surgery or something like that, and they come to us. So they have symptoms that are visible. Symptoms that, like, they can't walk, they get breathless when they walk for a short while or under doing their normal duties. Symptoms like getting pain in the chest, not being able to sleep at night because of the pain, and many other symptoms. The first thing when the treatment starts, the treatments run for about 3 months. They are not one-day treatment. The patient has to come to us if he's doing ECP for a month, every day for 1 hour. If he's doing the IV detox circulation twice a week for about 3 months, that's about close to 20 weeks, 24 weeks. Close to that. Close to 12 weeks. And when they start doing the treatment, halfway through the treatment, they see that all these complaints of theirs start automatically reversing. I mean, they don't feel the same complaints that they were having, the same symptoms. When their walking capacity increases. So there's a subjective improvement in the patient. This is the first sign that you see. Secondly, before we start with any patient, we have a full protocol that we go through. A complete list of tests are done. Blood tests, which do not lie. So when we do a blood test later on, post the treatment, you can see so many markers which showed that there was inflammation, intra-arterial inflammation, and so many other things have improved drastically. So before and after, patient can see these results. Secondly, many of these patients go and do a stress test with a cardiologist after that, and the stress tests that were positive have become negative later. But the most substantial thing that you see a patient telling you is that they are much better than what they came here for. And one test that can tell you for sure whether your heart muscle is getting enough blood supply is when we send our patient to what is known as perfusion studies or stress thallium perfusion studies. This tells you exactly how much blood is there, which is if the whole muscle is getting the blood or not, if the muscle is being perfused by blood. So when you do that, you see that it is absolutely normal post this treatment.
So, doctor, what are the other conditions that you treat here?
Oh, we do, being a geriatric physician, I have a lot of elderly patients who come here. We have people who come here with Parkinson's. We do a lot of Parkinson's treatment. We do a little bit of Alzheimer's. Most common is when people come to us and say we are getting a little bit of unsteadiness, so we can't walk properly, we are falling on the side. You know, that unsteadiness normally seen in patients over the age of 65, 70. We treat that with very good effect. Patients then are normal. They go for their normal morning walks. They're not scared anymore. They're not uncertain anymore. There's no this thing. And those treatments are much shorter in duration. Parkinson's is, of course, a little longer. Then we have done cases of multiple sclerosis, which is an untreatable condition. We have patients from across the world that come for it. I had a German patient recently for that. We managed to arrest the disease because there it's a very long process. We actually show the metals because we do a metal testing, which is there present in your body. We send the urine to the US, we get the reports, and these patients do benefit, really do benefit.
Do you find that yours is the unique treatment, the only center in Goa which is conducting this?
I think at the moment, yes. I have another colleague of mine which also I think probably does a similar treatment somewhere up north of Goa. But yes, we also have a complete holistic approach to patients. Why? Because we don't only treat this. See, this is one portion of giving you a complete, proper, healthy lifestyle. One is that you detoxify, which we do here. And it helps your heart if you have heart disease. But also we do a lot of anti-aging treatments. We regulate, we correct your hormone deficiencies, we correct your nutritional deficiencies. We eat a lot today, but we are malnourished because we don't eat proper. And most of the fruits and vegetables that come to you do not have the nutrition. So we correct those nutritional deficiencies in you. We check for you whether you have any allergies or where you have intolerance to any kind of foods. We do that too. And then we also teach you how to exercise. Because every doctor tells you to exercise. But no doctor tells you how to exercise.
How to exercise.
So it's very important that you tell your patient what he has to be doing. And we also teach people how to keep their mind absolutely calm. Because unless you have a free mind, a sound body, good nutrition, you are perfectly detoxified, and your hormones are in balance, you will not have good quality of life. And that is what we try to achieve in this clinic of ours.
Doctor, can you tell our viewers and the lovely people of Goa, this state, some strategies about your unique treatment? How will it help in building a better heart?
Yes. See, what we tell most people is that maybe 40 to 50% of the people can benefit from actually doing exercise regularly, going for a walk regularly, eating the healthy food that all of us tell you to eat. But there are another 40 to 50% who, in spite of doing all this, still get heart disease. We can see that. Now, why does that happen? That happens because the environment is killing us. So what we need to do is, besides doing all this, doing a regular exercise, having good food, good nutritious food, you need to supplement a lot of your vitamins and minerals. That's very important. Get a doctor who's qualified to give you good nutritional supplementation. Then, whenever you have the first signs of a paunch that comes about, because that shows that there's a metabolic problem,
right,
or your BP starts going up, you need to go and get yourself detoxified. That's, you do your IV chelation, because we have got smaller packages for prevention. And this is one thing that you need to look at very, very regularly. So what we normally tell people, see, to live a healthy life, besides doing all this, check your BP every month. Second, make sure that you do your blood tests, which look for these markers of inflammation, intraarterial inflammation like HSCRP, etc., once a year. If any of these go haywire, immediately start a preventive treatment, because it will be too late by the time you become a heart patient. If you start a preventive treatment, you might delay or even prevent the onset of heart disease. And that is my message to your viewers today, that they should actually look at these aspects, look at the preventive aspects, because I also treat patients in Southeast Asia. There people pay us to actually prevent this heart disease. They don't want to get heart disease. I have not seen that trend come into India as yet. I'm hoping that it will come fast, because that will help people have good, healthy hearts.
So, doctor, you feel that prevention is better than cure?
Always, always,
Can
always.
you speak a little, tell us something about
Yes.
how we can prevent all these?
Yes, see, what I tell...
And particularly in the area of detoxification.
Yes, what we tell patients is, one, that first is you exercise, because the very exercise early morning is a very good detoxification for you. Second, you need to have fruits and vegetables that are locally grown. Avoid getting fruits from all over the world, because they have all kinds of toxins and they do not have nutrients. They were plucked when they were raw. Nutrition in the fruit comes when it's ripening on the tree.
Right.
All right. So local fruits and vegetables, as far as possible. Try and eat organic foods and vegetables. Do not use vegetable oils.
Yeah.
Use things like olive oil and things like that. All right. Avoid carbs as far as possible. Decrease the amount of carbs, because we have seen that in our genotype or phenotype, whatever you want to call it, our genetic makeup of this part of the world, eating high carbs leads to spiking of insulin, and that is what causes problems. So we need to stop all that. And then finally, you need to come to people like us to get yourself detoxified. We give you IV treatments which run for about 5 weeks or 6 weeks, and you can get yourself detoxified once in every 2 years.
So, doctor, in conclusion, as we conclude this wonderful little interaction with you on World Heart Day, can you give a short message to the people of Goa and to our viewers?
I just wish them well. I wish them a very healthy and a wonderful life and a healthy heart right through their lifetime.
Oh, thank you, doctor. But before we close, I was just going through the visitor's book. And in the visitor's book, doctor, I saw a few wonderful little messages which speak from the heart. Doctor, you've given me a new lease of life. Doctor, this is not a hospital. but a house of God. Doctor, it's not only the treatment, but the affection that you've shown, putting your arms around me, telling me I will be well. And I'm sure, Doctor, the good work that you're doing, not only in the area of heart disease, but also treating elderly patients, which is a very important area in Goa. You talked about Parkinson's. We are very grateful to you, Doctor. And on this Heart Day, World Heart Day, we'd like to, on behalf of the viewers and this state of Goa, we'd like to thank you for all the pioneering and the good work, the unique work you're doing.
Thank
Yes,
you.
Doctor.
I'm honored. Thank you.
Thank you very much. And as we close this interaction with Dr. Lenny DeCosta, please remember to pay a visit to this unique center, Raphael Medicare, near Grace Church, Margam. You will certainly do yourself well by coming here to this unique center. Come visit Dr. Lenny, have a talk with him. He will treat you as a friend. Thank you, our viewers. And once again, on behalf of HCN, we wish you greetings, a World Heart Day.